Kerry Jean is our youth minister here at Springfield, and we're very excited and a little anxious. She's getting ready to do a bone marrow transplant, and it's a very serious situation, but we just hope and pray that everything's going to work out. We appreciate everyone who's considering helping out with this fundraiser. All the proceeds are going to benefit her and her medical expenses, and during this transplant, she's probably going to have to be in the hospital for maybe as much as 6 months, and so we know it's going to be extensive, but every bit of help will be greatly appreciated. And again, we thank you for working with us and for considering that, and we just ask you to keep her in your thoughts and prayers. Thank you.
Hi, my name is Kerry Jean, and I just really want to thank you all so much for your help and your concern, and during my time of need. As you can see behind me, I work with youth and children, and they're playing games in my yard. But next week I will be going to the hospital to have a bone marrow transplant, and I hear that's a pretty big deal. But I thank you for your thoughts and your prayers, and I just really think that something good is going to come out of this. Thanks so much to you.
That's over there. Oh, it's not. Who is it?
Leroy.
That's Leroy.
Oh, I wouldn't put that on nobody.
Golly. I didn't know that was Leroy over there.
Did you find my dad?
I can see his name.
Oh, no, don't do that.
What?
I'm just recording.
You mess it up.
Margie, how's Billy doing?
He's from my big now. He's got some bad infection. He's in the hospital several days. They sent him home on
Yeah.
Hi, I really appreciate you trying to do this benefit for my daughter. I have been down here since April when she all of a sudden learned she had aplastic anemia. It is a disease where the blood marrow stops making the cells, the white cells that promote immunity, the red cells that give you energy, and the platelets that cause your blood to clot. So she has had to live on other people's blood, and she tried one treatment of horse serum going into her body that was supposed to tie up the bad cells that were causing her bone marrow to not produce, and hopefully the little stem cells would come alive and do what they were supposed to do. Well, that didn't work. So the only other way to save her long term is a bone marrow transplant. I've been studying it a lot because a bone marrow transplant is very toxic. First of all, her body has to be completely rid of all the cells that is currently there, and that's done with high dose chemotherapy and total body irradiation. These have very negative side effects, and often patients don't live through these side effects. So I'm learning about that. But if we get past that, then you have to have a matched donor who is willing to give his marrow, which is through a thin needle that comes from the hip, where that is a big bone and a big deposit of marrow is in that bone. And that is shipped at the appropriate time when the patient has had his or her conditioning, and then that is put into the recipient through a port. It's intravenous, but it goes through a device here in the chest. Then, after 10 to 20 days, the doctor checks to see if it has engrafted. That means it has stuck. The little cells from the donor have accumulated and are beginning to grow in the recipient's marrow. The trouble is, it might not. That's another big problem. If they do, however, then there is graft versus host disease. It's where the new cells are rejecting the new body that they are in, and other organs are hurt. So there are 3 areas that are crucial that Kerry Jean gets through in order to be healed. And of course, I, as her mother, am studying all the different pre-treatments that different hospitals are doing and doctors, and trying to figure out what is the best method, because most doctors will listen to your questions. And since bone marrow transplants, and especially for aplastic anemia, have not been done for many, many years, 1968 was the first bone marrow transplant. So this isn't a science that is not refined down to the level where everyone lives. So I need to ask some intelligent questions and hope we get the best we can. Then I need to be in the hospital with her at all times and watch for any of these symptoms. I know the nurses are trained to do it, but I will be watching no one but her. And I certainly appreciate your interest and concern about these marrow diseases. There are other ones. The best well-known one is leukemia. In some respects, leukemia is easier to cure than this aplastic anemia, because when the donor's blood cells goes in on a transplant, it kills the leukemia, and then that lets the recipient's own marrow work. But in aplastic anemia, the recipient's marrow isn't producing. So that has to graft. That's very important. But thank you very much for your concern and your community service in helping another. Thanks a lot.